early childhood, I should say, in New Jersey. It's always fun and wonderful to be able to speak to folks back in New Jersey, and one day, inshallah, I'll be able to visit with you as well. I'm just going to make sure if somebody can give me a heads up if the mic is working and my slides are coming through, please, before I begin. We have a slide, yes. Are they showing up?
We can see the slide.
We can hear you and see.
Okay, excellent. Alhamdulillah. With that, inshallah, go ahead and begin. Bismillah ar-Rahman ar-Rahim. Wa sallallahu ala Sayyidina Muhammad wa ala alihi wa sahbihi wa sallam ajma'in. I was asked to speak a little bit about depression, stress, their signs, symptoms, and what I like to do, actually spend a good deal of time talking about myths. Anytime we talk about mental health for our Muslim community, or Muslim majority community, this is actually a really important thing to address directly and heads-on. Before I do so, I want to just introduce to you where I'm getting this information from, so that it's clear that you know my sources, and also to introduce you to some resources for yourself. The first of these is my lab at Stanford University. It's called the Muslim Mental Health and Islamic Psychology Lab. This is an academic lab in which there are multiple researchers, all of whom are working on different lines of research on Muslim mental health. You're welcome to visit the website and follow along the work that we're doing. And it allows you to be able to also see, the kind of work we're doing. Lita, mashallah, she mentioned multiple things, everything from how we as a community tend to look at mental health, which we have research on. She mentioned some difficult topics like the topic of suicide or substance abuse, which we also have lines of research on, and other such work. So I hope that you'll use this as a resource to you. The other thing that I would like to mention to you is these arches that you'll see on all my slides. It is actually the nonprofit organization that is part of my lab. It is connected to my lab, a partner with it, called Madistan. And I'm going to just introduce this to you because it'll come up again later in our discussion today. Madistan is the shorthand word for a longer Farsi word called Bimaristan. And Bimaristan is, in the first part of that word, Bimar, is an ill person in Persian. Stan, of course, is the place or location of. This word is used widely all throughout the Muslim world. Its Arabic equivalent is called Dar al-Shifa. And these were institutions of healing, like the ones Lina was referring to, that are all throughout the Muslim world. Everywhere Islam went, these institutions followed. You have masajid all throughout the world, of course, the Muslim world. You have madaris, or places of Islamic education, all throughout the Muslim world, wherever Islam went. And you also have madistans that went everywhere Islam went. Now, these institutions were hospitals. These were hospitals of the Muslim heritage. The interesting thing about them is they are the first in human history, of all hospitals in human history to our knowledge, to actually have mental health or psychiatric care within their institutions. I find that Muslims often don't even know their own history and heritage related to this. And certainly not people outside of the community either. And so we decided to call our organization Madistan. This is our namesake in hopes to actually revive this tradition. And I'm going to talk to you a little bit more about how we even got to this point and where it is we need to go, inshallah. Now, with that all being said, I want to share with you also the kind of work that we do, so you're aware. Here in San Francisco, the area where I'm located, and we have a clinic where we do training of clinicians who are hoping to work with Muslims or trained to work with Muslims, and also to be able to go elsewhere after being treated here. Secondly, we have programs that are for all people, that are open even if you're not a patient of this particular clinic. You're welcome to attend healing circles. In fact, we have one tomorrow. These are free and open to the public, and they are expert speakers. Tomorrow ours are on chronic signs of mental health conditions, for example. And then there's ones every single month. There are community trainings similar to what I'm hoping to do here with your community, and also other information pamphlets, even khutbahs on mental health that have been written, and you can find on our website, maristan.org. And lastly, the research that we do, everything we do, we hope to have backed by research, including everything that I'm going to talk about today. My first question to you for today is an honest question. It's a question that I heard Lina ask a little bit of it already. Do any of the statements that are here on this list sound like ones that you have heard, or maybe ones that you potentially have even said when it comes to mental health. I want us to be honest. It's an honest discussion. Because everything that's on this list, I've certainly either heard or have actually counseled families and people against. It is very common, not just in our Muslim communities, but also in other communities too. Mental health the stigma against it is actually ubiquitous. It's all throughout the world and all throughout communities. Some communities have it more than others. This concept of keep it in the family. Why would you talk to a stranger about this? Or why would you tell people that something was happening? People are going to talk. Or when somebody finds out there may be actually a mental health condition for somebody, will say, it's not from my side of it. You didn't get that from me. Right? And although it's comical, unfortunately, these are very real barriers people face related to mental health. Shame, certainly, sometimes religious language, like, this is something that's a sin. How did this happen to you? Because you are not strong in your iman or your faith, or you are weak, or things of this nature. The reason all of these items become important is because they actually act like hurdles. If you watch a track and field meet, you'll know when people run over hurdles, jump over the hurdles. It's literally like hurdles, and if you don't know how to jump over them, you may not ever get the help you were looking, may never get the help they actually need. Now, if we agree that some of these are definitely concepts that we've heard before, how about these here? Because according to our research, these are definitely statements that we have seen come up over and over again in our research on Muslim mental health. For example, that we really throwing the whole thing away and saying that's not, we Muslims don't have any of that. That's a Western thing. Or maybe people would say American thing if they're here in America, or so on and so forth. Or others may take a more faith-based religious approach and say, well, show me how the Prophet Muhammad sallallahu alaihi wasallam saw a therapist, because if he did, then I would go. I've definitely heard that as well. And I'm going to hope to prove to you all of these different things in measure in the next several slides that we're going to talk about. For others, and I think Lena mentioned this one, all you need to do is have strong faith, pray more, make more dua, stop being so lazy, stop being so complaining. All of this will go away on its own if you have better faith. And so the reason I preface the conversation with these statements is because even if you say, no, I've never said any of those, you probably have heard people within your family or friends circles say these things. They're common. And again, they're not specific just to Muslims, although some of them are more on the religious end, maybe. But these are things that many people deal with as challenges. They are barriers, they're hurdles for us to be able to get to the next steps. So what I'd like to do next is actually share with you a couple of different definitions so that we know what we're both talking about. And also I'd like to present certain myths. So if we look at this term, I would try to define it. It's called spiritual bypassing. Spiritual bypassing is a defense mechanism. It's basically when someone takes religion, right, their faith, spiritual concepts, and they use it to basically put a barrier and to avoid facing things that are actually psychological or emotional. It's the person who says to you, alhamdulillah, everything's fine, alhamdulillah, shukr, alhamdulillah, right? But none of the things actually aren't fine. Very much like in the story, thank you for your courage and bravery in sharing your story. She said people on the outside would never have guessed that she was dealing with something very heavy on the inside. This is a form, it can be a form of spiritual bypassing because we tend to do it and say, if Allah subhanahu wa ta'ala gave me this bala, this tribulation, then why should I do anything about it? It's what He gave me. Except that we forget that there's another part of our tradition, our deen, that tells us to seek out help when we need it. And I'll talk about that more shortly. It's also important to realize that our emotions are very complex. So are our kids. And if we frame this for children and adolescents, teens, college-age students, which we call transitional age youth, you'll find that it's actually pretty complicated. Parents have a really hard time trying to figure out emotions. And if you look at it, anger, sadness, confusion, guilt, right? All of these are actually considered to be experiences that happen. And parents often have a hard time figuring out, well, what is a reasonable teenage angst or anger? What is a reasonable sadness and feeling that the kid doesn't want to get out of their room or do much of anything? And what is considered to be problematic and actually needs help? And so it's important that we actually realize that these are complex, and sometimes we do need the help of professionals to walk us through them, right? Also important to understand that it does not occur because of a lack of faith or deficiency in one's worship. I'll tell you what I mean. One time I had a person who was telling me that they're a very, practicing Muslim, someone who prays 5 times a day, cares deeply about Islam, right? Practices it on a daily basis, but actually had clinical depression, the kind of depression that you are in your bed, not getting up out of your bed for days on end, not able to do much of anything for themselves, and truly reaches a clinical depression. And she said that every time she asked for advice, whether it's from friends or family, the imam, she was told, pray more. And she said, I love prayer. But if I'm not able to get out of my bed because of my condition, to be able to even brush my teeth or brush my hair, feed myself or take care of myself, even get to the 5 daily prayers, how am I going to do more prayers? If I can't do the basics, how will I be able to do the extras? So you see, we give advice that's well-meaning. We try to help. The problem is, sometimes we give advice that is misfired. It's not helpful. If the person can't do the basics, how are they going to do the more, right? So we have to be very mindful of what we say to people, including our own family and friends, including our own kids, right? And I don't mean to say that everything is a mental health condition. No, there's criteria. And we'll talk about this all in time, inshallah. I mentioned that I have some myths that I'd like to talk through. And there are 8 of these. And I want us to really think about if we've heard them before, and then to really push against them. So here's what I've heard commonly. As number 1, mental illness affects people with low IQ. As if to say, if you were smart enough and good enough and ambitious enough, you're not going to have a mental health problem. Well, it turns out that actually there have been people who have been brilliant in the past that have all had mental health conditions. A modern example of this is Professor Ellen Sachs, who's actually written a really great book that I encourage you to read, her autobiography called The Center Cannot Hold. And she actually has schizophrenia, which is considered to be one of the more serious mental health conditions in psychiatry. Not only did she become an attorney, but she became a professor of law, and then she actually served as USC's associate dean for a period of years. Imagine the dean of a law school actually having schizophrenia. It's incredible, actually. And just to show that this is not related to somebody's IQ, but rather it could be anybody that actually has a condition, just like anybody could break their leg, or anybody could end up with diabetes. Historically, there have been common examples of this too. Look at Isaac Newton, who historians of his past say that he very likely had bipolar depression and depression itself. That's important to understand, right? That these are conditions that very well may afflict anybody, regardless of how intelligent, quote unquote, they may be. Here's another. Psychiatric disorders are not pure medical illnesses like heart disease and diabetes. People that have mental illnesses are just crazy. I don't know about you, but like I said, I grew up not too far away from you in New Jersey. And it's not about being New Jersey or not Jersey, but in general, my community in general. was definitely, wherever I lived after I moved from that community, I found that other Muslim communities that I lived in had the same thing. And it's not just us, but certainly I speak for us because this is the community I'm part of. But this word crazy, or majnoon, or, jumbly, or whatever you want to call it in whatever language it is, comes up a lot with mental health. You look at somebody who might not be in their best state of health or mind, and just say, they're crazy, right? And it's so problematic. Because it turns out that mental health conditions, like any other health conditions, are real organ-based conditions. They're brain disorders, just like heart disease is a cardiac disorder, and diabetes has to do, right, with your pancreas. These are legitimate medical illnesses. And the more research we do on them, the more we realize there's actually often genetic and biological conditions, reasons for these. And we'll talk about reasons of how you end up with mental health conditions. When I tell people genetic or biological, especially genetic, they say, no. There's somebody in our family that has this. Almost immediately, that's the first answer when I do a psychiatric exam. And in time, I ask them other questions, and how about this, and how about that. And then it turns out that actually, there may very well have been a genetic connection over generations to the condition the person is seeing, let's say, in their child, right? And they think back and they say, in my parents, grandparents, aunts and uncles, maybe it was never diagnosed. But certainly there is behavior that probably would today have been diagnosed as fill in the blank: depression, obsessive compulsive disorder, right? Any phobias, anything else that's considered a mental health condition. And usually this is something that people kind of deny right at the outset, which is normal and common, but actually may have a part to play. Now imagine, if somebody already has a genetic predisposition, what we call a genetic loading for a mental health condition, it's not their fault. It's not because they're lazy, or it's not because they aren't smart enough to do better. There really may be something happening on a biological genetic level as one potential option. And we'll talk about other reasons for mental health conditions momentarily. How about this one? Mental illness is a result of weak iman, or faith. And therefore, professional mental health is useless. I've heard this so many times. And as leaders, and for me particularly, as somebody who in our community is considered a teacher of deen, somebody who's actually studied Sharia sciences and teaches at Islamic colleges, in addition to my medical training and teaching at Stanford University, a professor there, the combination, I live at this crossroads between religion, faith, and mental health. And this one I hear so often. And it's a very important one because of that term I said earlier about religious bypassing. And I'm the last person to tell you that Islam or faith or religion or spirituality isn't helpful. It is, and it's important. But using it as an excuse is not helpful. Remember I said I would share the different causes of mental illness? I want you to think with me about this word that's called multifactorial. When something is multifactorial, it means usually when a person has a mental health condition, we can't say it's because of one thing or two things or three things even. It's possibly multiple things. We talked about biology already, like genetics, right? It could also be a chemical imbalance. And people have found this through research. Researchers have found this very clearly. If you put somebody with obsessive compulsive disorder in an fMRI machine, their brain will light up in a certain section of it in which there is a deficiency. And the medications that are given actually help correct that deficiency. This is not made up, right? You can also have psychological aspects of mental illness. Maybe there isn't a biological or genetic part of the story, but maybe it's psychological, as in to say temperament or self-esteem, coping skills and emotion. I give the example of if a person was doing fine all their life, and then they experienced a real major trauma, or even minor. Minor, I mean something like a car accident. Many of us may have been in a car accident before. Why does one person come out of a car accident okay, psychologically, and the other person just has nightmares and nightmares and just really can't shake it off, and it's really hard for them, right? It may be a psychological condition related to trauma. Or what if it's a major trauma, like war? And so many of our Muslim community members come from countries in which there has been a lot of war and trauma. And maybe they have pushed it down so they can function every day in their daily life. But then something triggers it. A sound, a smell, a memory, and suddenly all of that comes right back above the surface again. And they're going to re-trigger it with memories of things that happened in their past related to trauma. This may not be a biological issue, but it very well could be a psychological or environmental reason for the mental health condition. Then there's social. Social are things like your social support, your family background, the one you grew up with, whether they are related to you, whoever your caretakers were, and whether you were treated well or not, whether there was a lot of fighting, potentially violence or abuse or not, whether you lived in comfort or difficulty, whether you experienced bullying, maybe by your classmates or schoolmates or teachers. There are so many reasons why a person can reach a point of a diagnosable mental health condition. And every person is different. Even siblings in the same family will have different outcomes, depending on these other factors: biology, psychology, social concepts. It is really important to understand and not deny, and not to say these things are just in your head, right? Because if we could put you under an fMRI machine, we could see that there is actually a chemical imbalance. That's something that's very tangible. If a person has been through trauma, even if to somebody else it doesn't sound like a big deal, but to them, it was in fact a trauma, right? And I know that there are people who are maybe listening to this and saying, okay, already, you're really pushing hard this mental health story. And the reason I am is because I have to tell you, and I didn't share a lot about my own background and my own stuff. A little bit I've said, I grew up in communities that didn't really accept mental health either. I had no intention of becoming a psychiatrist. I myself had a lot of stigma against mental illness. And when I went to medical school, I had every intention to become an OB/GYN. I had no intention to become a psychiatrist at all because of the stigma. But then in time, and in teaching in the community and really helping, it became very clear that there was definitely things happening in our community that even with religion and even with faith and even with health, it wasn't necessarily being addressed. And hiding it all, and kind of pushing it under the rug, sweeping it under the rug, wasn't helpful. And then it became really clear to me that it was going to have to take not only studying this field, but also trying to make sure we understood, even from a religious and cultural perspective, how to actually deal with these conditions. Which brings me to my next point. I wonder how many of you have heard this, or potentially even believe this. Not that it's wrong to believe, I just want to see how many of us feel this way. That mental illness is due mainly, some people will say, to the ayn, the evil eye, or to evil spirits like jinn. And then for their treatments, should be reading the Quran or doing ruqya, which is reading the Quran over certain portions of the Quran over the person. Now, here's where we have to really bring in, as I mentioned, the religious understanding along with the mental health scientific understanding and bring them together. Because we have members of our community that are on one extreme, everything is scientific, and the other extreme, everything is religious. Whereas most Muslims actually believe in both, and that's important. When I'm asked about this as a psychiatrist, I say, look, it's plausible because Allah subhanahu wa ta'ala in the Quran describes the ayn, right? Right? It's there, it's right in the Quran. And of course we have an entire surah called Surah al-Jinn. And so I'm not denying that these entities exist. We as Muslims believe in the supernatural. We believe just as Allah subhanahu wa ta'ala created the humans, He created angels, and He created jinn. We believe in this, even if we can't actually see them. Now, to say though, that a person's mental health condition is because they are possessed by the jinn, or because somebody gave them an evil eye, or the one that isn't here that's important as well as sihr, or magic, right? Black magic. Look, I'm not going to say that this is definitely is or isn't. I usually tell people, I'm a psychiatrist. I'm not a jinn doctor. And so, what I mean by that is, there are people out there, including some from the, of our imams and shuyukh who believe that they can do ruqya, or they can, and if a person feels that having that ruqya, or having that word, or reciting that Quran is going to help them, then let them use it. But it should not be exclusive to also getting the kind of psychiatric help they need, because it may be that it's actually psychosis and not a jinn. And so I tell people, if by reading your Al-Rad, or reading your ruqya, having the ruqya done, and you reading the Quran upon yourself, let's say, helps you, great. But if it does not alleviate your condition fully, this is a psychiatric condition. And so it becomes really important to understand not to, and I find extremes again, right? Even with doctors, some are like nonsense, garbage. And I'm not okay with that, because again, as I mentioned, it's directly part of our deen and our culture and our tradition. But I'm also not okay with the extreme of only religious. And this is where we have to actually have a balance between the two. And interestingly enough, our scholars of old, I love one whole line in my research in the lab is on historical understandings of mental illness and Muslim heritage. And we pull out the books from the 7th, 8th, 9th, 10th, and centuries onwards of Islam, Islamic heritage, civilization. And it is fascinating. Because to me, this giraffe, this amazing heritage, rich heritage that we have, was very holistic. And I'm going to share more about this, because it helps solve our modern issue about mental health. You see, we have scholars like the one I have on the screen here, is Abu Zayd al-Bakhi from the 9th century, who I've written extensively about. And who, by the way, my papers that have been published in mainstream medical journals have proven that he likely was the very first in history to be able to classify and diagnose certain psychiatric conditions like OCD, obsessive compulsive disorder. And I have a different paper on his work on phobias, for example. And he says there's something so eloquent and so beautiful. He says, look, even if you think that this waswasa, which all of us have a certain level of waswasa, obsession, right, as understood by our faith, but he talks about an intense form of waswasa, a kind of waswasa that is so intense that you can't shake it easily. You can't just say, A'udhu billahi minash shaitanir rajim, and it goes away. It's the kind of waswasa that interferes with your daily living. And he described it so well in another day, another time, where I can point you to the journal that I published this in. I compared his criteria to the DSM, which is the Diagnostic Statistical Manual of Psychiatry, where we psychiatrists today diagnose from. And eventually in the 9th century reaches the exact criteria of OCD that we use today, a millennium later. And so we have to rewrite the history and explain the Muslim contribution, right, to psychology and psychiatry. And that was amazing in itself, but I also love what he says. He says, look, even if you believe that this waswasa, right, this very intense waswasa, is coming from the shaitan or from some other supernatural source, you should still seek out therapy, in addition to any Quran or Awad you are doing. And not only does he say therapy just for the sake of therapy, he actually describes the kind of therapy somebody with OCD should use. And it is so meticulous that today it matches the gold standard treatment of OCD we use today. He describes a type of cognitive behavioral therapy, or CBT, that is specific to the condition of OCD, and that is called exposure therapy. Today we use exposure therapy or exposure ritual prevention therapy for OCD treatments, and he actually describes it. And when the reviewers of my paper looked at this and read it, not only were they amazed, but to know that this was something he thought about in the 9th century is just amazing. It should give us a lot of pride in our heritage and a reminder that when the early Muslims understood that we are meant to treat all conditions, not just body-based conditions, they didn't discriminate about mental health. And they gave very sound treatments and suggestions. And this is our tradition, and we need to get back to it. There are also the ahadith of the Prophet ﷺ that I love to really make sure we say. And there are several narrations, and I put 2 of them here, in which the Prophet says, there is no disease except Allah has created, except that He has also created its remedy. And in some narrations it says its cure. These are Sahih traditions from Sahih Bukhari. Why am I saying this? Because even the messengers and companions asked the Prophet ﷺ, should we seek out medical treatments? I need to say, is it enough to just read Quran? Is it enough to just pray? And look what he says. He says, yes, you should seek out medical treatment because Allah the Exalted has not let any disease exist except that He has provided its cure. Except for one thing, and that is old age. There's no magic serum to turn you back younger, subhanAllah, right? But everything else. And this is when COVID broke out, I said, we should be the Muslims at the forefront of this because we have this hadith. And we have the impetus. This is what inspired our scholars of old to figure out whatever they saw, any condition they saw, they said, well, Allah must have also sent His cure. Let's figure out what that is. And that's what you see in their books. And it's not just theory. And I'll share what I mean, because they actually built amazing institutions like the medicines I just presented to actually carry out those treatments. Few more announcements, inshallah. What about this one? If you have a mental illness, you can will it away. I hope by now in this part of the lecture, you're ready to say clearly that this is not true. That mental illnesses cannot be willed away. That the problems just do not go away on their own. And that it does take courage to seek out professional help. It's not comfortable. It's not easy. It may not be something anybody in your friends or family circle has done before. But please know that this is something that's going to not just disappear. A lot of these conditions are chronic. They come and they go, they have ups, they have downs, but they don't just disappear. And sometimes, and we find this often, I was talking with the psychiatrist who will be presenting with me tomorrow in the medicine healing circle that I was telling you about, which all of you are welcome to attend, inshallah. And she was saying the same thing to me. We both have observed this, that in Muslim patients, we tend to find that they come much later in their illness. As if to say, we wish that they actually came earlier. Because if you have less stigma to mental health, you'll come to the doctor quicker and earlier. But a lot of times people have tried everything else before they come to us. They talk to their family and their friends, they talk to their imam, they've tried home remedies and herbal remedies, they tried everything possible before coming to us. And what happens is, when you have a mental health condition, and the longer you wait, and the longer it goes untreated, the worse it becomes, and the longer it takes to actually treat it. And so, speaking of children and young people, several of the more serious mental health conditions show up in youth. They show up somewhere in the teens or in early 20s, depending if you're male or female. And when people ignore these, it just gets worse and worse. Other conditions depend on, certain things like postpartum depression will only come, of course, after pregnancy. And so it depends on what age that was. And so on and so forth. And it's just unfortunate because it comes back the next time stronger and harder. So I hope, inshallah, we're all encouraged to seek out the help. And from what I heard with Bergen promised just earlier in the introduction, it sounds like there's good access to your community and partnership, which is wonderful. Here's one that's very common. Psychiatric drugs have many side effects and can cause addiction, and therefore I don't want to take them. Well, I'm not denying that medications can have side effects, but all medications can have side effects, including the Tylenol you take over the counter. It's important to know what the medication you're being prescribed is, who prescribes it, who is monitoring it, that you're carefully followed, that you yourself don't become your own doctor, and that to know that if it's actually due to some sort of imbalance or chemical deficiency or hormonal issue, that it's really important that medications potentially has a role to play. And please know that not all medications are actually addictive. There are some, but not all. And not every psychiatrist or even doctor is ready to use the most addictive ones. In fact, the practice of the field is the least amount at the lowest dose that's effective. And it may be that the condition that you or your loved one has needs more. And that may just be the case. And so I realize strongly that people are really worried about this. But I also want to tell you, we talked today a lot about OCD already, and I do a lot of work with OCD. If even though people do the therapy, if they were to take the medication, you see intense improvement, and very quickly. It's very interesting. Like, you won't get the full treatment without the medications as well, depending if you have a more, moderate condition of OCD, for example. Not every psychiatric condition needs this, but some do. And that's where we make the distinction between a mild to moderate mental health condition. And only your professional care provider can help you figure out what it is exactly. So I hope that's useful. Last couple ones here. Counseling is useless. I've heard this my fair share of times. Therapy is useless, it's not for us, Dr. Rania. Okay, everything he says is medications and getting care. The therapy, I still have family members and loved ones of mine who are like, everything sounds okay up until this point. I'm talking about counseling. Here's the deal. Just like you look for a doctor or any other thing, any profession, you're an attorney, you're a plumber, the baker you go to, not to minimize these issues, but I just want to explain, just like you have to be comfortable with whoever you seek out any sort of help with, your mechanic, who you trust, it's a trust factor. And it's somebody who you feel like you can open up to, and that you trust the quality of their work. And if you're not comfortable with them, find another one. Sometimes it takes shopping around. I give the example of when people are coming to get married, and so they kind of are looking for spouses, and so they may go through this kind of period of time where they're figuring out who's the right fit, right? It's a little bit like that in finding a therapist too. If you don't find it comfortable with one, look for another, right? Because ultimately this person is someone you're going to talk to in confidence. Confidentiality is part and parcel of our field. You cannot possibly benefit from anyone unless you have some confidentiality. And so this is part of our field. Please know it, that they're not meant to go and tell the whole community. They can't. They will literally lose their license if such a thing happens. And they're reportable to their board. See, this is a professional field. So it's not just like somebody you talk to at the community center who doesn't have any board governing them or any license governing them. Counselors, therapists, psychiatrists all have a board in which they're licensed by, and they are reportable. So they are very careful with their confidentiality, but they do not breach this, right? And that's another reason why talking to professionals versus a lay person. So I encourage you to consider this, and I remind you that talk therapy was something the Muslims not only figured out, I won't say they were the very first, but they certainly were some of the first to really hammer out what talk therapy should look like and how it could be very beneficial. This is our heritage. We should claim it and embrace it. Lastly, apology is a Western concept. That's not from our tradition. I hear this a lot, this statement. And it bothers me so much because, as we mentioned already, that these medicines, these psychiatric institutions, they didn't just write, our predecessors, they didn't just write about theory in books that are yellow pages now. They actually took theory and implemented it into practice. I like to say the proof is in the pudding. The proof is in the pudding. You can see very clearly that they were able to build some of the most forward-thinking institutions that later inspired the hospitals we have today. Literally, modern hospitals took their blueprints from the Muslims. And in terms of psychiatric care, like I said, there were no hospitals before that had any proof that there was a mental health or psychiatric section in it until the Muslims came about. Why? Because of that hadith, because of that impetus. If you're going to have a section to treat heart conditions and a section to set broken limbs, you're going to have a section for mental health. There was no discrimination or stigma against it from our tradition. So we really have fallen far, far from our tradition, subhanAllah. And not only that, but when the non-Muslims who also lived and were treated within these institutions, because again, wherever Islam went, they were Naristans, they described them. And because they're not Muslim, they don't have a reason to praise them, right? But in their descriptions and their logs that we write about in our research and our papers, it is very heartwarming. They talk about very clean institutions. They talk about how those who are mentally, have mental health conditions have bathing and clean clothing and activities, what we call the psychiatric milieu. They had talk therapy, yes, music therapy. People have a hard time with this, sound therapy. They use the adhan, they use the Quran, they use the maqamat, tones. That if you're really, really anxious, they would calm you down with some of the sound, the tones. And if you were very depressed, they would bring you up with custom tailored music therapy. Now, in the field, music therapy is this kind of new age, wow thing. No. The Muslims figured this out long before. They said, look, all of your organs, all of your senses have to be healed because holistic understanding is what mental health, and they understood mental health to be, mind and body together, right? And so they had massage therapy, they had medication, they had the sayqala or the shifa khana that made the medication within that hospital unit. They also had rounding team, interdisciplinary team of doctors, of care providers, the doctor, the nurse. But they also had, and very interestingly, the dietitian who figured out their meal. They had the pharmacologist who compounded their medication and treatment. They had the person who today is like a social worker who figured out once they were discharged how they were going to get helped. And they had the religious leader, person who came and did walks or helped them with religious, spiritual help. Very interdisciplinary. They understood you had to have it all together. And they rounded on the patients every single day. It sounds like Stanford Hospital today. The doctor, the nurse, the pharmacist, the dietitian, the social worker, and the chaplain. But this is what the Muslims had. And again, we're far from these traditions and we have to revive them, inshallah. Now, the best part of the story is how was all of this paid for? It was free. It was free to the Muslims and to the non-Muslims. It was free to all because they used from Bayt al-Mal, the zakat funds, for some people, and then the majority was the awqaf, the endowments. In our tradition, our Islamic tradition, healing the ill, visiting the ill, taking care of the ill is considered to be very highly praised. And if you put something as an endowment, as a waqf, Lillahi ta'ala, an endowment for Allah, until the end of time, it continues to reap you benefit and blessings, a sadaqah jariyah, ongoing charity until the end of time. This was our tradition. Including, because later the hospitals, the mental health hospitals became standalone institutions just for psychiatric care, later in Islamic history, and it was the same thing. Our people, our predecessors, didn't have these stigmas. Unfortunately, with some colonization and some other factors that came in, we lost some really beautiful heritage we used to have. So modern Muslims tend to not even know about this and have the same kind of stigmas that came from medieval Europe against mental health that we didn't have naturally, right? And proof of that, and these are the last couple of slides that I have, but proof of that is when you look at the lessons from the Quran and the Sunnah, Just for anybody here who's kind of like, okay, that was all nice, Dr. Rania, but I'm a little bit still not really sure. Here's some really clear messaging, inshallah. That Allah subhanahu wa ta'ala reminds us about the plans that He has for us. And there are clear stories in the Quran directly from the life of the Prophet sallallahu alaihi wasallam, the Prophet Muhammad, but also from other prophets about how they dealt with intense sorrow and grief. I remind people, there was a whole year in the Prophet's life called Al-Amul Huzn, very intense difficulty and intense sorrow. One thing after another was happening in the Sira there, right? We have parts of our tradition that talk about cognitive reframing. Like, for example, this ayah of the Quran that talks about if you hate a thing, it could be good for you. And perhaps you love a thing that it's bad for you. Or other traditions where the Prophet reminds us that if Allah subhanahu wa ta'ala sends us an affliction, it's to better us. Right? Cognitively refrain harm and healing and tribulation. Right? And very holistic self-care. But that did not prevent the Prophet and his Sahaba and Sahabiyat and his wives and the people close in that community to get care when care was needed. So you have Sayyidah Aisha was one of the first Muslims to actually treat and diagnose illnesses, including psychological illnesses. And if the life of the Prophet himself isn't just giving people Quran and Hadith and Sunnah, okay, but she's also giving people physical treatments for psychological conditions. So there's the Nadina, or the soup that was made of like barley and milk and honey. And people say, that's something we should use today. I don't think it'd be a love item. But the point is, she gave something that was physical to a psychological condition like depression. That is very important. They understood that it wasn't just spiritual. Right? And when they asked her, where did you get this from? She said, I learned it directly from the Prophet sallallahu alaihi wasallam. Now, to close this out, inshallah, there were two main things that I was asked to speak about: depression and stress. And I want to make sure that we talk about these factors. I know that Bergen Promise, it sounds like on the bags they're giving you the tote bag, they have some of these conditions on there, or these reddish flags, if you will, which is great. That way you can take it home with you. But let's just review together. What are some of the things that if we found within our family, our friends, our loved ones, our children, that we would actually make sure we understood these are red flags? If a person started to lose interest in activities that they otherwise liked, your kid loved playing certain games or visiting with certain friends, and suddenly they show no interest in that anymore. A lot of feelings of worthlessness or guilt. I'm nothing, I'm nobody, this world is better off without me, this kind of very negative, cynical language. Or it could show up as crying, irritability, agitation. This is really important too because it's very age-specific and dependent. Sometimes kids have a really hard time having the vocabulary, the words, to explain what's happening. So instead, they just start acting really agitated and irritable, and nothing is making them happy, and they're just so agitated. But it could be that they're actually dealing with some bullying, trauma, depression, something may have actually been happening there. So when you see these flags, it's time to ask for some help. Increased sleeping or decreased sleeping, insomnia or hypersomnia. So when a kid, this is when people say, well, does my teen sleep until the middle of the day in the summer? Is that the case? And no, that may be normative to the teens, mashallah. But for everybody else, if they start sleeping, they're just pacing at night and not able to sleep. Adults or youth, both, right? Or they're just sleeping way too much, not getting out of bed. This could be a sign of depression. Increase or decrease in weight. Either could happen. Person just is taking all of their sorrows and difficulty by eating, right? Or by not eating at all, because they have no appetite, no interest in food anymore, right? And so you say, well, how do I know? How if they're sleeping or not sleeping, eating or not eating, gaining or not gaining? How do I know? This is why a professional is needed, right? I'm not expecting that you would have the answer to this, versus somebody who's been through literally 12, 13, 14, 15 years of schooling to be able to come to a point to be able to answer these questions, right? Same with diminished concentration, slowness in their physical or mental activity, and especially the last one, It's very difficult, and I give my trigger warning because I will talk about this concept of suicide or death. And some of you may know that in my lab, we published a paper in a very prestigious medical journal, JAMA, the Journal of American Medical Association, which is the top-rated journal in the medical field. And we published a paper in last July, a little less than a year ago now, on suicide in Muslim Americans. And it was terrifying. The numbers are very high. And when we did comparative with other faith groups and people of no faith, Christians, Jews, Hindus, Buddhists, agnostics, and atheists, Muslims had nearly double the rate of suicide attempts. Not deaths, but attempts. And of course, the more attempts, the more likely deaths will happen too. Why am I saying this terrible news? I'm saying this to you because as a clinician, and all of us who are in the field, we kept seeing this and seeing this and seeing, and sometimes we hear it on the news. There was a terrible incident in Texas just this past week, as some of you may have heard. And we keep hearing it and seeing it. But there was no research, there was no data to say exactly what was the issue. And there's more research that we're carrying out right now, and one very important study that I'm carrying out on Islam-based resiliency, character and moral traits from the faith that helps with resiliency against this. Because I really believe it's there. But I think we as a community, A, need to start talking about it. I'm so proud of everybody who's here today because you're taking a very courageous step to even talk about these things. And B, to take it head on. To not keep brushing it under our masjid rug. These are real issues that are happening. And our youth, our kids are really being affected. And if the pandemic has taught us anything, is that all of us have dealt with some sort of mental health consideration in this pandemic. So like was said at the very beginning, and Evelina said it, the silver lining of the pandemic has been the more clear and honest discussion around mental health. And lastly, I was asked to speak about stress. And stress is something that is part of the mental health umbrella. And there are natural mechanisms that God created with us to be able to help us when we're in stress. Some of you may remember from school, fight, flight, or freeze, right? That if you're stressed out, right, something happens. You see harm or danger. It's built into our system to either fight or run, right? And sometimes also to freeze. And so we have to help the brain, the higher function brain kind of shuts off, and your reptilian brain, or your more kind of lower function brain is what keeps on going during this period of stress. And then when the stress is relieved or the danger goes away, right? This is like if a lion jumps out at you, or not a lion, if you're hiking, right? You know to run, or you know to, get help, right? So this is a good thing. The problem is when it's chronic stress, and that is a modern phenomenon. We have much more stress today than our predecessors, our great-great-great-grandparents ever had. Everything from a pandemic to financial, academic, job-based, interpersonal things related to our families, our marriages, our children, than we ever had before. So you realize then that if you have chronic stress, it's almost like somebody's pressing that button and keeping it pressed. Keeping the person in that fight, flight, or freeze mode. And when the body is chronically stressed, then it can't respond appropriately. So stress actually is something that needs help. And so you say, is it a psychiatric condition with medication? No, not necessarily. But this is where counseling and therapy can be very useful, right? And for anybody who says, no, I don't need that. If your life has been affected by the pandemic in some way, or there's other things happening in your family or work life, trust me, counseling can be very useful. And of course, I encourage that it be culturally congruent, religiously congruent, preferably somebody from your cultural and religious background if they're available, because they'll just understand more. But any professional who's trained, some help is better than no help at all. And that's really important to say. And so the last thing here is to know that there are multiple ways of healing and treatment. We talked about some of them. There is the clinical aspect, like we talked about, whether they be medications or even hospitalization. But then there's also social support. Every research study we have ever done in the lab that talks about Muslim mental health has always shown that when you ask people, who will you go to first if you felt that you or your loved one had a mental health condition, the answer is always friends and family. So please, all of you here who are friends and family, please know that you are the first line responders, not me, and not the clinicians. Usually psychiatrists and mental health therapists and providers are at the bottom of the list in our communities. After friends and family, most of the research has shown imams were next. And then eventually, right, come the mental health providers, maybe a primary care doctor, and then the mental health providers. The research is changing. Your children, this next generation, is starting to consider mental health a lot faster than the parents' generation. And they're more willing to go to mental health care and counselors than the previous generation. So we might find this switching soon. But friends and family will probably always be first line. They will probably always be the first people. So know that you have a very important role in the story of mental health. Same with lifestyle, like diet, exercise, sleep, and actually having recreational activities, being able to seek out things that allow your heart to care, to give you a breather. There's a reason why in Sunnah, prophets like Sunnah, there are things like Sunnah sports, archery and horseback riding and wrestling. There must be an outlet for people to be able to be holistic and balanced. And lastly, spiritual. And most importantly as well, prayer, dua, prophetic lessons, all of these help. But none of them, no volunteer on its own is going to be able to work on its own. They have to be an integrated whole, and that is our tradition. So if you feel that you or your loved one needs that kind of help, please know that help is there. Please know that when a person says, when should I seek out this help from myself or my kid or my loved one, it's when you find that there's interference with your daily life, your work, your school, your interactions with other people, your marriages, your raising of the children. When there starts to be a bleeding into other aspects of life, this is where there needs to be help. And because I mentioned the very difficult topic of suicide, I will also say this is one you can't ignore, please. Usually people, the research shows that those who have attempted or even died from suicide, the research has shown clearly that in the week or two prior, they have dropped hints to people around them. They have said things like, it's not always a note, sometimes they just say things like, what's the whole point of this world? You guys would be better off without me. I don't know if this is important. I don't know. They're just statements like this. When you hear these, please do not say, oh, be quiet, stop talking, that's haram, haram. Please don't say these things. Right? Please realize that this is a red flag. Somebody's waving a red flag for help. They stopped being able to see the light at the end of the tunnel. And I need help, and please know that out of all the mental health conditions, suicide is 100% preventable. We just need the kind of education and help. My lab in medicine actually has a wonderful training. We spent years in the lab creating a whole manual on suicide prevention, intervention, and postvention, which means the crisis response and the aftermath, unfortunately, of suicide. A whole manual, 100 pages, fully robust kind of research findings in which we took the science and integrated in it the Islamic understandings. And we realized that you can't give a 100-page manual to an imam or a person, so we did the next step this year, which was creating trainings, actual modules. You can contact Madison and get a full certificate-based 8-hour full training to anybody who's a leader. Our imams, but our youth leaders, our board members, anybody, our Sunday school teachers, anybody who's on the front line of dealing with people, especially our youth, right? And they can be trained in this. And I think it's very important given the stats and the data that I just shared. If you hear this kind of language, please, this is where you need to go directly to the emergency department, the emergency room, please. There's always a psychiatrist on staff, 24 hours a day, any ER, and so any big ER. So please make sure you get that kind of help for your people. And if it's not that serious, as serious as something like suicide and some other mental health consideration that we mentioned, then please do reach out. Like you have now this partnership with Burbank Promise and other such partnerships. And please remember, friends, family, and our imams and religious leaders, you are the first responders. So please use caution. please try to advise people to get the kind of help they need that's actually going to benefit them from the professionals that can actually help them as well, inshallah. With that all, I thank you. I hope I didn't take too much, inshallah, of your time. I hope this was useful. I left here on the screen some of the kind of contact info, especially actually the social media links. For anybody who is on social media, you're welcome to follow any of these accounts. We actually strive to put out mental health content for Muslims almost daily on our channels and our accounts. You might learn a lot for you and your young ones, inshallah. So I do hope that what I shared here today, and also whatever happens throughout all of our programming upcoming, is beneficial to you, inshallah. Thank you again so much for this opportunity, and I hope to see you again in person, inshallah, in the future soon. Barakallahu feekum. Alhamdulillahi Rabbil Alameen. Wa sallallahu